much. Well, after a lot of discussion about the technicalities, etc., it is time to discuss about the model. What is my experience in with different brands of C-arms in a different setups. Now I have a small nursing home which is 10 bedded. Plus I go to mid-size hospitals. So I'm trying to give my experience of working in different hospitals with a different setups and different at a different point of time. I've been using Siam since almost 22 years, 23 years rather. So now this presentation is merely an experience. It is sharing of an experience with different models of image intensifiers, whether in a private setup at a different point of time, in different environment and different setup. It is not a technical evaluation of the available intensifiers. And the presentation is intended to weigh the pros and cons of the different units I have worked with. It is no way endorsing a particular product. Now, as you are aware, all of us are hooked to the gadgets, and it has become a part of an integral part of our life. The same way, the CM has become an integral part of the ortho surgeon's life. Now, what questions while working with the different makes? What questions arise? Are we satisfied with the image quality? What does one look for in the CM? Now, for comparison, we selected 4 commonly used image intensifiers in a company in the places where I go. I would not like to name the company's name, SAMP. I have just written randomly. Now, what do you look for the criteria? Criteria which we devised were quality of images, the saving of images, means the memory function, then the ease of operations, then maneuverability and positioning of the C-arm, how difficult or easy it was, radiation to the surgeon and the assistants, the cost of the C-arm, service areas and AMC, and the overall advantage versus disadvantage. We tried to cover up all these points. Now, assessment was based on the quality of the images. Now, the appendicular skeleton, hip and pelvic region in an obese patient, the spine imaging during instrumentation was assessed. Now, appendicular skeleton, well, practically all the image intensifiers had a similar image quality. The hip and pelvic region, particularly in an obese patient, make S scored over others. Then spine imaging during instrumentation, again the MAC S was scoring over others. This I'm talking over the years. Possibility that the newer models may have a better quality and possibly they have a better radiation standards. Now the most can save, now the imaging saving and in the memory of the images, most of the instrument makes which we are using, they save approximately 100 images. Now, one Mac in particular, which I am still using in one of the institutes, can save only 4 images, which was not adequate. So when the machine was installed, we inquired with them. What was told that either you can have a laptop or you can install a certain particular software. So and at an extra cost. So it adds to the cost, etc. And so while buying, ask them how many images can be saved and what is the method of saving. Like whether it is saved in the image intensifier itself in a memory, or it has to be saved in a separately in a computer or a hard drive. Now, maneuverability and a positioning, we found that positioning, maneuverability dependent much on the size of the OT and the shape of the OT. Like in a smaller setup, maneuverability and positioning was extremely important because the maneuverability, if it is lesser, then the in a small setup, private setup, it becomes extremely difficult. The length from the arm and from the machine, it is ranging from 5.5 to 6 feet minimum. Now that is a fairly decent amount, so that one has to the operator and then operator has to stand in about 1.5 feet. So one needs to have at least 7 feet area from the image acquiring place and the person who is operating. So that has to be kept in mind. Now that possibly has to be reduced. Now some image intensifiers which are newer ones have reduced that size almost by a feet, which is a added advantage. Now almost all had a similar disadvantages and advantages. Now what I have used in that. Now ease of operations is extremely important. We have already discussed about that, and everyone has to understand and know what are the what are the gadgets. Gadgets contains many
Icons.
marks, and they have a symbols. Everyone has to know. The person who is handling, in majority of the small setup, in a nursing home setup, the ward boy or a technician is being taught. There are no X-ray technicians in a smaller nursing homes. So what is important is that they have a very friendly console. It is not, no doubt about that. And the trained personnel for the operation of CM is required. My sincere most advice is, as Dr. Tanna told, train yourself. You should be knowing how to go about. Even if the CM gets conked off, and one of the speaker has mentioned initially, I think Mr. Kanodia, that you have to open the panel. There is no time for opening the panel. So what one can do is that instead of now CM has a system wherein it goes into memory, and from memory it is goes into the display. So if there is a direct management can be done, which was available in an analog system, which was available before. So that is easier. Another thing which I want to ask is that I was provided in the first CM when I had bought, I was provided with a small plate, which if it is attached, then you can take an X-ray. Though the quality of X-ray would not be good because the image intensifier has conked off. It is not the X-ray unit which has conked off in that. So the X-ray beams are emitted and they are being captured on a small normal plate, which we used to use at that point of time. This was a pre-digital era. So I am not sure whether it is available now or not. And it has not been provided to any of other setups where I am going. But I just would like to put that question to Mr. Kanodia, Mr. Singh, and Mr. Hens. Now, the cost, there are wide variations. The commonly used CMs have a ranges from 7, 8 to 15 to 20 lakhs. Now, there are some of the CMs which are slightly on a higher side. They have range going almost up to 40 lakhs. Now, whether it is worth it or not, that one needs to decide about it. Now, when one tries to do the cost cutting, whether the cost cutting is effective or not, whether the quality is suffering or not, one needs to really go into the depth of that. More often than not, when the cost cutting is done, they have cut down the cost on some main equipment, and then the cost cutting is not very comfortable at the end. Now, AMC area, it should be like one call and secure service. You should make a one call and everything should be arranged. There was time when we used to make a call and we would get the answer immediately, and they would try to rectify the problem on the phone, and which had helped us number of times. When the now servicing is not a problem in the metro cities, they are costly, and the AMC is comprehensive or regular. Now comprehensive is going to be extremely expensive. They charge almost 10% of the original cost, which is quite high. The regular AMCs are cheaper, they are available, and there is something called, I use the word, call and pay. So when they come for the service, you pay. That is also available to a smaller nursing home where the cost is a factor. Now, while negotiating for the new unit, insist on the extended warranty. That will ease your mind in the pocket, because that is going to be extremely important. Now, 24/7 support, even if they say it is not available, it is not available. So we should keep it in mind. Again, here also comes to the train yourself. Now, how do you assess a quality of a unit? Service, quality, efficacy, and ultimately you are responsible for seeing that. Now, this is what I had done, the small comparison chart I had prepared. Now, this is something, again, I'm mentioning, this is not, just a second. Oh. Sorry.
We can reboot it, yes, sir.
Yeah. This is a chart. This is comparing at that point of time. Possibility is there. There might be a different gradations right now. Now the quality of image was very good in May case. All others were good. Now saving of the images was in fact not very good in May case, which I was telling that which was a premium brand. Others had a good quality. I mean, one could have saved almost 100 images. The maneuverability and position was good for everybody, except that the span of the machine was quite big, which was quite difficult in a small setup. The ease of operations were good in all of them. The radiation claims by the manufacturers were minimum, but we are not too sure about that. But as Dr. Sanavne has pointed out, that each machine has to go through the AERC protocols. So I don't think that when it has gone through the ARC scrutiny, there can be a difference in the radiations. And the cost was very high in Make S, others were low. The service areas again, the Make S used to charge very high, others were high low and sometimes low, sometimes high low. So it is how much you negotiate, how much you do that. That is what it matters. This is the quite comprehensive summary. I hope it helps in buying something when one has to buy new. Thank you very
Right.
much.